again for setting the stage for my presentation and for our esteemed colleagues that will be presenting after me. I really value the opportunity and thank Johnson and also the planning committee for organizing this forum and for the opportunity to highlight the important information that we believe is in our community health assessment report. And it's only looking at when we really increase efforts of looking at the social determinants of health that we believe that the road will widen in order to really achieve a healthier Ventura County. As I pondered in terms of the task before us today, in terms of further addressing social determinants of health, I wondered really what the takeaways or the questions, the key questions I think we should all be thinking about. I think the majority of us here in the room are healthcare professionals, and within the healthcare agency, I know we have some community partner organizations as well. But I would like to offer that as key questions or takeaways from my presentation, and I think also from our esteemed colleagues, is basically two questions. One is how can the information that we're going to be gathering today or discussing, how could that improve our efficiencies in terms of how we're doing our program planning and how we're delivering service. So please ask yourself that as we continue with my presentation together. So the other question is really how can this information lend itself to increased opportunity for us as different departments within the agency to further collaborate and integrate our services, and also how can we increase our community partnerships with community-based organizations. And thirdly and finally is how does this information, is it going to help us to really fully engage our clients, our community, and really attain healthier Ventura County. So please consider those questions as we go through my presentation and the ones after me. In terms of a quick outline, this is what I hope to cover today. First, a little bit of background in terms of social determinants of health and health equity. Share with you some highlights in our report that are demographic and socioeconomic status indicators. Talk a little bit about the social needs index that really drives home that in many places, but including in Ventura County, place does really matter when it comes to health outcomes. And finally, I'll touch on a few priority areas just to give you a glimpse of the content of our community health assessment. So that's what I hope to accomplish today. I'll begin with this question: what impacts health the most? Oftentimes, we believe in the healthcare system, healthcare setting, that it is clinical intervention, education, counseling that really impacts health the most. And certainly when someone is, any of us, when we're sick, really the top of the pyramid is really critical, and that's going to impact us the most. But when it comes to population health, when it comes to overall community health, it's really the base of the pyramid that really impacts our health the most. And that's when we get to the discussion of social determinants of health. In fact, it is these socioeconomic factors that are the main areas where we can improve health. And when we're talking about social determinants of health, we're talking about education, housing, transportation, really large social, even political, economic sources and environment that is conducive or not to health. Certainly, again, the personal responsibility and individual health care is very important, and so is the middle areas of this pyramid. It's also very important and they impact health. In fact, in public health, it's widely recognized that immunizations, smoking cessation interventions, smoke-free laws, and other types of laws such as DUI prevention and seatbelt laws have had the largest impact on health. So it's very important to address all of these. But when it really comes to making the big changes in our community, it's the bottom of the pyramid that is most important. And that is, in fact, the topic of today's session. Now, you might wonder why I'm starting off today's presentation in a room full of healthcare providers. Definition of health. It actually is because if we refer back to almost a 70-year-old definition of health by the World Health Organization, that organization, back again 70 years ago almost, as highlighted there, put an emphasis on not only mental but social well-being in addition to the physical aspects of health. But oftentimes we only talk about health as in sick care, when we're treating the individual when they're sick. And so we usually, I think the traditional sense of health, we talk about the absence of disease, but it's really a complete state of physical, mental, and social well-being. And I like this definition again because it draws attention to the social aspects. Since then, many have offered additional aspects such as spiritual and even financial well-being as really what drives home a healthy community and a healthy individual. A little bit in terms of the social determinants of health. Again, I think all of our speakers are going to touch on this. I'd just like to offer some thoughts and some perspective background on the actual topic that we're addressing today. Simply said, social determinants of health are the conditions in the places where people live, so our housing, our physical environment, where we learn, our schools, our educational system, where we work, is our health coverage, are we part-time, are we full-time, what are our wages, do we make a living wage, are we even employed, and where we play, the conditions of our children, are there streets, safe streets, sidewalks, are there parks? It is these conditions that really affect health outcomes the most. And so again, this is really a basic definition of social determinants of health. It's the conditions in the places where we live, work, and play. And some examples then of these conditions are, as I mentioned, education, housing, our physical environment, our social status, and our poverty or opposite of that, our income, really is what drives health. Oftentimes when we talk about social determinants of health, it's in the context of health equity. And before I offer you a definition of health equity, I'd like to contrast it with health inequities. So this definition is that health inequities are preventable, key, and therefore that's why it's bolded. It's preventable or it's avoidable differences in the burden of disease or opportunities to achieve optimal health, and that these are experienced usually by socioeconomically challenged and vulnerable populations. So this definition is in contrast health inequities to health disparities. Oftentimes folks interchangeably use health disparities and health inequities, but I like to think of health disparities as simply health differences. There's always going to be differences in health outcomes. Sometimes if you're young, you're going to disproportionately suffer some diseases versus the old, male versus female, and some of those are expected. They're not necessarily preventable nor avoidable. But when a disease outcome and a burden is something that could be prevented or avoidable, or it's unjust, then it's a health inequity. In terms of actual health equity, it's often been said that equity is achieved when everyone is given the opportunity or the resources to reach their full health potential, where they can thrive, where they can live long, healthy lives. So that is health equity. I think that's one of the outcomes that we, as a healthcare providers in our system, but also those of us addressing social determinants of health, we want to get at health equity. Before I proceed, I'd like to just recap a little bit in terms of our department strategic plan. A couple of years ago, we came up with this vision statement and also mission statement. Our mission statement draws attention to the environment and also about well-being. But in particular, our vision statement, we did some interactions with our frontline staff, and they really challenged our leadership at the department to adopt this version of the vision statement, which is we want to be the healthiest county in the nation by 2030. And although lofty and perhaps grandeur of this vision, it's really consistent with state and federal leading public health organizations that have also challenged our entire healthcare system, our nation, to be the healthiest in the country, healthiest state, and healthiest county. So I'm pleased to share that vision that's in our strategic plan. It's also in your copies of the community health assessment, and that I also present it because it really is going to take a whole community of all of us here as agency, healthcare agency, but partners to achieve this vision. In your packets, you have a summary of our community health assessment. This is what it looks like. At the end of my presentation, there's a link on the website, but basically this report is mostly available via electronic, and so it's on our webpage, and it's also on our Health Matters in DC.org data dashboard, and that address again will be at the end. And we hope that you utilize this as a tool in again helping you plan and deliver services to the community. Also, in your handout, as part of the summary of the community health assessment, is this handout, and it has a little bit more information. This is not our original. We in public health, we did not come up with this model, but we adapted it to Ventura County. Many have used this model of the onion to demonstrate how important it is to address various factors, not just the individual or even the family, in addressing a total community, to achieving total community health. It really is issues that are more in the social and the physical environment. So having adequate and safe housing, having cultural norms that are conducive to healthy living. It's economic opportunity and educational attainment and supports. it's also safety in the neighborhoods and in our families. And it's also having access to food, healthy food and positive media messages. All of that is really going to drive population health outcomes a little bit more than individual factors. And so what does a healthy community look like in Ventura County? We believe it's one that is going to achieve health equity, where there's going to be increased attention of health and health policies, and we thank our board of supervisors for adopting a health and health policies framework, where cross-sector partners in the community, whether it's law enforcement, planning, are going to look at how their policy, the practice, or the program impacts health, and who is it impacting. Also, part of a health community is doing periodic health assessments, and as Jonathan said, it's not just doing the assessments, but tracking progress. So our community health assessment mainly summarizes the most current relevant secondary data that is available that we have access to. But before I share that data, I'd like to also let you know that we did about 1,000 surveys and asked residents themselves to let us know, answer a couple of questions. I just offer you one. So these are the responses, both out of the almost 1,000 respondents, about 2/3 responded to this question in English and about 1/3 in Spanish. You see the difference here. I think it's interesting to note that everyone of almost 1,000 respondents in Ventura County in our community health assessment chose health access and health coverage as their number one area where that'll make a health community. And that's important. That can be a social determinant of health. But I think it's telling that factors 2 to 5 are really social determinant items, factors. So I think our residents, our community, is really in tune already to the social determinants of health and how they impact health. So for example, in the English respondents talked about low crime and safe neighborhoods as contributing to a healthy community, a clean environment, so social and environmental justice, schools, and yes, behaviors and lifestyles are also important. Interesting to note that the Spanish respondents, they also added affordable housing as among the top 5 contributors to a healthy community. So I think it's telling again that our residents are already in tune to the social determinants of health as per this, the responses here. Real quick, in terms of the, for those of you that are from outside or guests from outside of Ventura County, a quick recap of the demographics in our county. This is the latest information that we have through the California Department of Finance. Basically, Latinos and whites are the largest ethnic minority group, with Latinos only slightly below in numbers to whites, and the rest of the ethnic racial groups are around 10%. So that's current. Now, in 2060, the same California Department of Finance estimates that by 2060, Latinos will become the largest ethnic group at 55%, and Anglos will reduce to about 31%. So if we really want to address the health of the entire community, we need to address all racial and ethnic groups. Also, it's interesting to note that by this year, we're expected to hit the 1 million mark in terms of residents. We're at about 860 residents right now. So one of the topic areas in our community health assessment is life expectancy. Life expectancy is one indicator of the health of a community. Now this slide presents some interesting, I believe, and good news overall. So our life expectancy in Ventura County is 82 years of age. On average, we're all expected to live 82 years of age. That is higher than the US life expectancy. Females, they know how to live healthier, they have a better and higher life expectancy. And so, but perhaps those differences are more due to a health disparity. It's a health difference, male versus female life expectancy. But look at the top bar and the lower bar, the ones by zip code. There's a 12-year discrepancy or gap in life expectancy in 2 zip codes in our own county. Another way to display it is this. Zip code 93022, which is the Oakview, I believe the unincorporated area of the Ojai Valley, has a 76-year life expectancy. That child is expected to live 76 years old. Same age child living in the Westlake Thousand Oaks area is expected to live 12 years more than that child. So one has to ask now, is that a health disparity? Is that an expected, naturally occurring, an acceptable difference? Or perhaps is it a health disparity, a health inequity that's causing that difference? And so we'll examine that a little bit more. So the important, this is a little busy slide, but I just put this one in there to draw attention and to solicit your interest in looking up your zip code and seeing what your life expectancy is, but also to remind myself to let you know that whenever possible, our community health assessment breaks down the data by zip code, by city, by race, by gender, wherever we can slice and dice the data at the lowest denominator, we try to do that. One more, I think this is my last slide with regards to life expectancy. I mentioned, I think at the beginning, or I had the slide in there about the social needs index. This is a nationwide measure that takes into account socioeconomic indicators and gives them a score. The higher the score, the more socioeconomic need. And then it compares that score to a health outcome. In this case, it shows life expectancy. And you begin to see a pattern here. In the darker areas, those are the areas that are have higher socioeconomic need. In other words, there's more poverty there, there's lower educational attainment, and the life expectancy you see is actually quite lower than in the more affluent areas of our county, much higher life expectancy. So it does appear that in our county, place, in fact, matters. I'm going to go through these next 3 slides quite quickly. I just still wanted to include them here just to interest you in looking at our report, where we've done a years of life loss analysis in a new methodology consistent with the World Health Organization. And so when we look at leading causes of death, it's always interesting or important to look at preventable causes of death and to see how the young and middle age are dying, not as a whole, but particularly the young population. Causes of death, here they are for overall causes of death on the left, and then premature causes of death are on the right. It's actually, cancer has overtaken coronary heart disease in our county, and I think in the state, but not in the nation, as the #1 killer. And that's both for leading causes of death and also premature death. Heart disease is second, but if you look at now preventable and premature death, we look to see a different picture, what's actually leading to premature death in our own county. You can see now that it's accidents. It's accidents, accidents, drug-induced deaths, suicide make the top 10. Actually, suicide was #9, but it moves up to 6. Drug-induced deaths, accidents now make up the top 10 when it comes to premature death. That's why it's really important to look at premature death and years of life lost. One last note in terms of years of life lost. This slide examines how many years of potential life was lost due to this type of death. Homicide is the #1 cause of premature death. On average, if you die due to a homicide, you're losing 57 years of life. So there's great opportunity for intervention there. Also, drug-induced deaths, there's almost 47 years of life lost due to that. And there you see for the rest, including fractures. So there's a lot of great opportunity to examine what's really causing these premature deaths. Now, the main time that I'll spend now, the minutes of my time, is really calling out some factors, some indicators in our community health assessment in each of these 5 areas. These are the 5 areas that we chose in our community health assessment as areas for increased focus in order to have a healthier Ventura County. One is creating healthier communities. So we talked about how important the environment is. So I think it's critical then that we talk about what is going on in our community. I've chosen just 2 indicators around education and poverty, just to give you a glimpse of some of the baseline information that we have in there so that we can track it in future reports. So first, the next couple of slides are on educational attainment. And we start to see a pattern around disparities and more actually appropriately, perhaps health inequities when we talk about education and poverty. First, in terms of education, this is educational attainment for residents 25 years and older by city. And you see that if you have a high school graduation rates are much higher in certain communities. You see that close to 90% here for Camarillo, Moore Park, Simi Valley, Thousand Oaks, close to 90% graduation rates for those 25 years of age and older. However, you can again start to see this pattern that areas in the Santa Clara Valley, Fillmore, Santa Paula, and then the Oxnard Plains, namely Oxnard and Perquinini, have much lower rates of high school graduation. Similar pattern in the gray is bachelor's degree. The more eastern cities of our county, the more affluent counties have much higher rates of folks living with that have earned a degree, a bachelor's degree or higher. So just as education is a great predictor of one's health, so is poverty. And especially when you look at poverty and educational attainment together, you begin to see another pattern that is emerging. The green or yellowish bars are those poverty rates if you have less than a high school graduation. You see that your chances of being living in poverty are much higher if you don't have a high school graduation. But then again, there's big differences in those poverty rates in the cities of, for example, Fillmore, all high schools does stand out in this one, but then the other ones, Oxnard and Santa Paula, have very high poverty rates for both the high school, those at less than high school graduation rates, but also with the bachelor's degree. Much higher poverty rates for those with a bachelor in the Oxnard Plains and Santa Paula area. Lastly, in terms of poverty stats that I'll share with you, Johnson mentioned how children, of course, is our future. We have to really address health disparities, health inequities among our children, and especially if they're poor and not getting a good education, it's going to lead to poor health outcomes. And my next slides will demonstrate that. But basically, again, in the cities of Fillmore, Santa Paula, Oxnard, Perwanini, children, upwards of 35, almost 40% of children are living in poverty. Healthy beginnings, of course, we do want to focus on children's health. One indicator of poverty by school district is the percent of students eligible for free and reduced lunch. And you see that, again, in the Oxnard and the Santa Clara Valley school districts, upwards of 75% of children there are eligible for free and reduced lunch. So again, another proxy for poverty in those school districts. And so what is this leading to in terms of actual health outcomes? I just happened to choose obesity because it is a main risk factor for the leading cause of premature death and disability, which are chronic diseases. And so you see that in the same school districts, close to, if not over 50% of the students, fifth grade students in those school districts that I pointed out before in those cities are overweight or obese. And how are we doing as adults? Using, again, obesity as a proxy of the health of the community. This is by zip code, but you'll see that about 1/3 of residents in the Santa Paula and Oxnard area are overweight and obese, much higher than in the East County, the lower rates there. But even then, in the East County, and having the average of 20 to 25% overweight adults, in my opinion, is still too high. Real quick on the next slides, as I attempt to conclude here, is because cancer is now our leading cause of premature death and overall death, we do call out cancer in our report. And these are the top cancers, age-adjusted death rate. You see the lung cancer, female breast cancer, and prostate are the leading causes of death among those with cancer. This slide gives you a glimpse of the leading health conditions for folks on Medicare. And interestingly, you see that it's hypertension, almost or a little bit over 50% of those on Medicare have hypertension. Almost 50% of them have high cholesterol, have arthritis, have heart disease, or have diabetes. And a lot of these conditions, of course, are have a social determinant of health component. Our last area that we call out in our community health assessment is redesigning our health system. And I really, again, thank the Planning Committee and Johnson for having this summit, because it is only when we address our healthcare system and how we collaborate with our partners and how we engage the community that we're really going to make a dent in the health of our community. Health coverage still remains a big issue, especially when you look at the rates of health coverage and health insurance among Latino versus white. You see the Latinos are still very much underrepresented in terms of health coverage. And although this data is a little bit outdated, the rates are higher, but disproportionately still Latinos are much higher uninsured rates. The leading preventable hospitalizations. So as a healthcare system, of course, we need to address preventable hospitalizations, and this is what we found in our report, that it's heart failure, bacterial pneumonia, urinary tract infections, diabetes, and COPD are among the leading top 5 areas for hospitalization. And some of these, again, lend themselves to interventions when we look at social determinants of health and we look at individual differences by zip code. So in summary, I hope that you can find a way, again, from what I highlighted or from our actual report, to utilize in your day-to-day planning or delivery of service, but also that you accept the challenge to further look into social determinants of health, because we believe that only then will we really have a lasting impact and to improve the population of Ventura County. So with that, I'll conclude, and thank you very much.
Rigo, thank you. And you see that Rigo's email is there and the link is there. Those of you who are within the system or are outside the system and are interested in looking at the entire report, I would highly encourage you to please look. It's full of wealth of knowledge. So I want to bring a couple things to your attention. Those of you who are new to the building, outside the door, straight to your right, are the restrooms in case you need. There's some drinks in the back. If you get thirsty, please do so. And I do want to apologize to Dr. Landing back there, who had a very important point to make, and I totally skipped her. So thank you for arranging for that. I do want to acknowledge a few people. It took a lot of effort to put this program together. And I do, in a few minutes, will tell you how this all came about. But internally, I do want to thank Adriana, Sheila, Dr. Lambing, and a few of the folks that helped put this event this afternoon together. So really appreciate it. Thank you very much.